So what we know with our death certificate data is that it is not accurate at this point to be reflective of our nursing home death information, which is why we do not rely on that and we do not report from that for nursing home data. We rely on the nursing homes to do their own reporting, and that is the number that we report for nursing home death data. Now, when we need to, and we will at some point, have to do a verification or a validation against the self-reported numbers and what we have in our death certificates, because those death certificates are public record of note, and that is, in the future, the data place that people will go to identify different, aspects for data analysis and summary when they're looking back on how this pandemic affected the state. We do not at this point actually have the data points that we need to do that match. We've known for years that our data collection platforms in public health were outdated. So there's a reason we can't do these matches right now and we have to do them manually, which is we don't have the interoperability between our systems to do it.
The ones that have 12 or fewer residents, they are not self-reporting. We do not have those numbers, correct?
We are not requiring them to self-report.
Okay.
That's correct.
The ones that are 13 above, all of those are reporting?
No, not all of those are reporting. I wrote this down because I knew you were going to ask me this one. Right now we have 273 out of 311 reporting.
So if they're not reporting, wouldn't our number be too low? You said you're using their reporting.
Well, here's, again, I'm talking about nursing homes. If you want to talk about the broader long-term care facilities,
I guess I'm
when we
talking
talk about adult foster care, then the contention would be they are underreporting, and at some point we will have to go back and do a validation. So if we don't have all of them reporting, there could be a contention that they're not reporting deaths, or maybe they haven't experienced any deaths. I don't know the answer to that.
So when we do a vital records review, like they did between March 1 and June 30, are they catching those numbers that are not reported in that review, that 648 number?
When we do a review of death certificates, we're not doing a comparison to the self-reporting. Those two things don't go together.
Why? Wouldn't you want to see if they're matching up? To me, that would be pretty common sense.
I can't tell if they're matching up because I do not have the data points from the self-reporting to do that match. That's what I'm trying to tell you.
So to be clear, that 648 death number was not, you didn't take that number and add it to the existing long-term care facility death number. You believe that's already baked into that number?
Yes.